Hey, welcome everybody. Ronnie here by myself. Jason is off camping. I don't even remember where. Some campground here in Oklahoma. He is texting me as we talk right now. He's trying to get a connection and he is not having any luck. So you guys are just stuck with me and the good Dr. Miller here in a second. But we're here on episode 25. It is June 7th, 2024 here in Tulsa, Oklahoma. And oh my gosh, there he is.
Hey, can you hear me?
Well, I can. Jason, I was just telling them that they may be stuck with me and the good doctor, but it looks like you finally got a connection. So anyway, I got Dr. Miller's bio here, but tell us what's going on. What are you doing?
I'm in the middle of nowhere, Oklahoma, southeast Oklahoma, out here at Robbers Cave State Park, and you can see the water behind me. But proceed on, Ronnie. I don't want to interrupt you. I'm just glad that I've made it.
Okay. Yeah. So again, it was this is June 7th. So as you guys know, I've kind of talked about it with Jason the last couple of weeks. I've went back to homicide as a civilian, working cold cases, and so just continuing to plug away with that. We've sent a few lab requests off to maybe get some DNA or fingerprints tested on some stuff from back in the 80s. As far as some other stuff going on with the homicide guys this week, it was fortunately a quiet week for them. There weren't any new cases that I can remember. Reggie had one of his cases that our warrant squad was getting help from another agency out west of Tulsa or here. So I don't know how much of that they're ready to talk about or be public yet, but he made some progress on one of his cases today. So that was a good deal. If you guys remember from last week when we were talking to Doug from Colorado, there's that DNA system. Jason and I next week have been asked to give a presentation to some people here in Tulsa, and we may be able to get some funding to help purchase one of those devices for ourselves. And so we're hopeful that we can make that happen. But anyway, what else you got, Jason? Well, Jason's dealing with stuff.
I'm on a big video show here, guys.
What else you got? What else do you got to say?
Basically, well, I mean, this has been a fun trip. I knew that this was going to be tricky with this Wi-Fi situation. I'm going to review the Wi-Fi that we had picked up and bought when we went to Florida. It's going to be a 1-star review when I get done. But nevertheless, I made it through this, and to be able to be here, I'm honored to be here. I'm really excited about this because when you read his bio, I want you to read because I don't even have it. But one thing that's really cool that I'm excited to talk to him about is the fact that he was a burn tech back in the day.
Oh, and right up your alley.
Right on. Yeah, love it. So get to it, man. We'll talk more. But like I said, most things have went without a hitch. Most.
Okay. So, yeah, this is going to be my first reading. I probably won't go through the whole thing. I mean, it's a huge bio here, but yeah, our guest today, if I haven't already said that, is Dr. Ross Miller. He's with the Oklahoma Medical Examiner's Office here in Tulsa. He was born in Lincoln, Nebraska, 4th of July in 1982. He was raised a Catholic. Let's see. His dad worked for computer networking for the state of Nebraska. Let's see. He likes fishing and camping. He did track and cross country. He didn't make his soccer team the freshman year. He wanted to become a doctor at a young age for combinations of reasons. He broke his arm when he was 5, had to be hospitalized for it. It destroyed my grandfather, who was in charge of me. Never forgive himself, even though it ended up being a nothing booger in the end. He got to see lots of doctors and medicine and hospitals, and he thought it was all cool. His father was a paraplegic. He hurt himself in a snow skiing accident while in college. He went to NAI College in Hastings, Nebraska, studied biology, and then basically pre-med. Let's see. He, according to the medical examiner's website, he's been with them since July of 2015. He received his medical degree from the University of Nebraska in 2010. He went on to complete his anatomic and clinical pathology residency at the University of Nebraska. He then completed his forensic pathology fellowship at the Jackson County Medical Examiner's Office in Kansas City, Missouri. Dr. Miller is board certified in anatomic and forensic pathology. He's an active member of the nation.
Nice.
A couple of things I'll just say real quickly since he put him on here. He says his wife is Jessica, an amazing woman who's a pharmacist. Cammie is a daughter going into the 7th grade. Naomi, 10, going into the 5th grade. And Jimmy, 18. So it looks like he's got a rescue dog. So I guess with all that saying, hopefully I didn't butcher that too much. But Amanda, I guess let's go ahead and bring Dr. Miller on, and we'll hear from the man himself.
Hey.
How are you, sir?
Ronnie, that was great. I'm doing well. How are you two?
I'm doing well. Jason's
on day 3 of context for the first time in my life. So I'm sitting here looking at this, and it's not quite what I should be seeing, but I'm here. So it's good. Thank you for being here.
Well, thank you guys for having me. This is great.
So Dr. Miller and I, the first, we were talking about this before we came on air. I go to Lifetime Fitness down here in South Tulsa, and I think that's maybe the first time we ran into each other. You remember the story better than I do. What's the story with that?
Oh, yeah, it was, well, when I moved into town in 2015, I mean, my wife loves crime shows, so we watched the First 48 all the time. So it's almost like I knew all the Tulsa homicide detectives before I actually got a chance to meet them, through work. And, we joined Lifetime because of their kids center, when the kids were young, when we moved in. And was walking down the hall, and Ronnie's wearing his basketball shorts. He's doing like some crossovers in the hallway. And I just played it cool, walked right by him. And then I looked over to my wife. I was like, that's Ronnie Leatherman. He's in the First 48. I know him, and that's kind of how it was at first. And, ran into Jason at Bill Knight Ford randomly while we were getting our cars serviced and had a long chat. And so
I talked to
it's
your
just a
ears
small
off.
world. We're in a big town, and I knew I'd eventually run into you guys at work, but still being able to run into you guys out in the community was wild.
And I briefly talked about how you got into the medical field, but I guess if you will, in your own words, you can probably do it a lot better justice than I did. What kind of go into a little bit more detail on this broken arm and then stuff you dealt with that led you to medical school?
So yeah, the arm story. So pre-cell phones. So studying, I was 5. Mom and dad were driving to a small town by Lincoln Creek to do furniture shopping, left me in charge with my mom's parents. And I just eaten a peanut butter and jelly sandwich. Grandpa wanted to wipe my face. I said, "Nar," ran up the slide, and I was mocking him from the top of the slide. Next thing I know, I'm tumbling off and had a compound fracture. And, my next door neighbor jumped in his car to run after my parents because they couldn't get a hold of him. He rushed me to the hospital. Their initial assessment was I wasn't ever going to have full use of that arm again. And it destroyed him. Like, to the day he died, he was like, I never forgave myself for not taking better care of you that day. I was like, Grandpa, I'm fine. You don't need to stop. It's all right. You don't need to torture yourself about it. So, yeah.
So what?
No, that was, I mean,
I was just going to say, what stood out to you was there anything in particular with the doctors or the medical staff in general that you dealt with that you're like, oh, these guys are cool. I need to do this.
It was just, I mean, all things considered, everyone was really nice. I remember just an air of, I'm going to get taken care of. I had my stuffed raccoon, Rocky, and they gave him a little cast. And, I actually thought the food was good, and there's lots of toys in my room. And so, it was like for it being a traumatic experience, it was very positive from the medical side of it. And so, that first piqued my interest in medicine. But I mean, most of it was actually dad, after, he my entire life, he was paraplegic. So, I mean, he was in and out of the hospital, seeing doctors a lot. And so I got a lot of experience or a lot of situations where I'd be around doctors and would see what they would do. And so, it was one of those where once I saw it and once the thought was in my head, that drove me. I was like, I'm going to be a doctor. And so like junior high, high school, college, that was always the goal.
So did you find, so I don't know if I've talked to you, I'm probably not. I actually retired from the police department a couple of years ago as an officer, and I was working still with the police department as a civilian over at our crime lab, right over there on your guys' campus, and as an analyst with the police department. And so the OSU medical school is there, and we would always see when we were on a break or something, we would see all these doctors, and there were times they just seemed like they were as happy as all could be and sitting out on the quad area eating lunch. And then there was other times they looked so stressed out it was crazy. So what was kind of your experience with medical school? Was it harder than you thought, or are you just super genius and got through it without any problems?
No, it was tough. I mean, it took it to many levels above high school and college. And one of my best friends in med school, Brian, he's had like a photographic memory. So he'd see things once and he'd know it. I need to see it over and over and over and just repetition. So med school is essentially go to classes, go to the library, eat terribly. Just Mountain Dew and Cheetos was my diet. And then at night, come home late and try to decompress by playing video games and then do it all again the next day. But I mean, it was worth it. The first year was definitely the hardest. But I mean, it was kind of what I expected. I had psyched myself into med school is going to be tough. And I mean, it was, but it's doable. All it takes is hard work. I mean, if someone's got a drive and a will to do it, like they can do it. I try and tell when I go to the schools, I try and tell the kids that like, it's not some unattainable goal. I mean, if you want to be a doctor and you set your mind to it, I mean, you can do it.
Nice.
Something really quick. What we have in common, and I had no idea about it, is that you were at Burn Tech, and so was I. I worked at Baptist Burn Center in Oklahoma City for 6 years, and I worked in my job was debriding people and doing burn dressings. And the same stuff, exactly what you were doing. And there's and actually I worked in surgery as well. And there were a couple of surgeons that had asked me. They said, "Hey, listen, if you could get through the MCAT, we'll get you through the interview, and we'll help you." I don't know that they were going to help me financially, but they were willing to help me. They were willing, because I think I could do the surgery part of it. You know what I mean? Because I'd worked in surgery for so long. But so what was that like working in the burn center for you and going on from there?
It really cemented going into med school. Like I took a year after I graduated because I wanted to focus on my GPA. And then for the year after I graduated, I worked and studied for the MCAT. And I knew that med schools would want some medical experience, on a resume to make me competitive against other people going in. And so just knew the burn unit. And so applied, got in there. Actually, one of my good friends, John, who's in Omaha still, he was a burn tech with me. He's a urologist now in Omaha. And yeah, it was Burn and Wound Care Center, St. Elizabeth Hospital. And it was essentially the same thing. Debriding, cleaning, doing patient tubs, doing what the nurses wanted me to do, a lot of wound care stuff, decubitus ulcer care, things like that. Got experience with like wound vacs, and it honestly, I thought for sure I was going to go into patient care when I went into medical school, when I was going to choose my specialty, because I really loved dealing with the patients, got a rapport with them. One of my favorites was a 16-year-old gal who was hurt really bad in a car wreck, was paralyzed, really depressed, got wounds. And over the course of, 6 months, we were able to, get her out of that, get her going, get her eating, get her taking care of herself. And, and seeing those people leave better than when they came in. It was very satisfying. So I thought for sure, I was like, I'm going to do family, going to do pediatrics, maybe I'll do surgery because I like anatomy. And then I started interacting with patients with the white coat, and I was like, oh man, I don't know, what have I done? I need to rethink things. It was something else once I actually started. It was very different, interacting with people as a burn tech was easy. Then dealing with people, once you put that white coat on, they treat you different. They look at you different. The first patient experience I had, I was like, Dr. Wheatley, I'm going to go in there. I'm going to nail it. I know what I need to do. I'm going to go solo. He's like, all right, go do it. And I went in, and at the time we still had clipboards on the door, and I saw what she was in there for. But we're taught when you go in, you don't just immediately do a physical exam. What are you doing here? What brings you in here today? And I asked her that, and she goes, well, you have the clipboard. Why don't you know? Tell me why I'm here. And I was like, oh no. So this is how this is going to go. And it just ruined, and I just kept having interactions like that. And I was just like, I don't know. I want to be happy at my job. And this is just, regardless of all the great things that would happen, all the fun patients, the good patients, the success stories, it would be those negative, I guess you could say, patient interactions that I would take home with me. And I was like, I can't do this to myself.
So I know Jason has talked to me several times. I've known him forever now. He often has told different stories of when he was a burn tech, and just how just him in general, how he connects with people. And so I think there was more than once where stuff was just super hard on him because of what those burn patients were going through. And you kind of talked about a good story with that girl. And Jason had some good stories, but there was a couple that he's told about that didn't end well. And so how are you able to deal with just all the trauma and the pain that these people were going through? And did you get personally connected to any of them? And how did that go?
I'm so far removed that I've kind of forgotten names, but there was this elderly gentleman there that was he was a chronic patient. I mean, the minute that he would get released, he would be back. He had wound issues. He was a paraplegic, and I don't know. It was just being compassionate, going in there and talking with the guy and hanging out with the guy. And again, as a burn tech, I had a lot more freedom, when I wasn't doing tubs or I wasn't debriding or helping the nurses. I could just wander around the ward and just hang out with people. And a lot of the times, and you'll even see that now in forensics, especially with decedent families, I mean, they just want someone to talk to. They just want someone to know what they're going through, and just listening and being there. And so that was very helpful. I mean, unfortunately, that gentleman died in the hospital. I think I was fortunate enough that most of the times that the actual death process was occurring, I wasn't around. Like that's one of the, I guess you could say, I mean, morbidly so, I guess, benefits of forensic pathology is, I mean, the death has already happened. I didn't see it happen. I mean, occasionally we do from investigative stuff when that gets shared with us, but I mean, by and large, by the time they get to me, all of the very traumatic stuff as it's occurring has already occurred. So it does make it easier to deal with.
Yeah. So I grew up watching Quincy, and I could Holiday Inn in Los Angeles, and I'm looking through the window and I'm watching across the street. And as I'm watching across the street, my mom's like, "What are you doing? What are you looking at?" And I'm like, "Mom, they're bringing bodies in." It was the LA County Coroner's Office, and you every now and then you could catch feet, or you could catch, you could tell it was bodies. I know this isn't crazy stuff, but I like, I think I want to do that job. That looks like a cool job. My question to you is, listen, Ronnie and I have smelled the smells, and we've seen the beetles and the maggots and all this other stuff. And I hate to be graphic, but that's just the reality of it. My gosh, I know for a fact you have got to go home with just the smell of death in your nasal pharynx that's just stuck up in there for days. And I don't know. You see so much horrific things to the body. do you just get used to it, or I mean, I don't get used to the smell, and I've been around it forever.
Yeah, it's just something you get. I mean, it's like you said, it's just something you get used to. I mean, I still remember the first true dead body I saw, apart from what we had during anatomy and medical school while I was in residency at UNMC at pathology. It freaked me out. The eyes were still open, and yeah, I was like, man, this really smells. This is really terrible. And we would put mint like drops in our masks to try and cover it up. And considering what I've seen now, like that was nothing. Like
Yeah.
it's just something you get used to. You never enjoy it. Like the decomposition smell is terrible. I mean, I didn't even know there were maggots that like skipped around and jumped around until we opened a body bag once early in my career. And I'm like, what is this? Why are they flying at me? And so it's just something that you just, once you've seen it, you get used to it, and it. Like it's random thought. So during the Casey Anthony trial, I know that mom talked about the smell of death, like in a trunk.
Yep.
And it was like, yeah, I mean, you can't. And then she later changed it to, well, it was just like rotting pizzas. No, it's a very distinctive smell. And so
That if
if you
stop
smelled it, you know it.
On the way home,
Correct.
I have no doubt that when you stop off at the store on the way home, there are times when people are like, golly, that guy smells really weird. Because it just
yeah. And we don't smell it ourselves either. Like it gets in the nasal hairs, and it just kind of sticks there, and the nerve endings get used to it, and so you don't even realize it anymore. And I'll come home and Jess will be like, you stink. You need to take a shower. You need to get out of whatever you're in. And I'm like, what do you mean? I don't feel, I'm fine. Yeah, it's just, again, it's part of the job. You get used to it. I mean, it's honestly just a lot of that stuff just becomes distractors, from distractions from, the main point of the job. And I mean, I really do enjoy forensic pathology in that I get to be someone's last doctor. And so if I'm going to be their last doctor, I want to be their best doctor. And so, if my job is to come up with their, a medical opinion for their cause and manner of death, I'm going to ignore all the distractions as much as I can so that I can get to that best opinion possible.
If we can back up a little bit, I guess. So you had that bad experience, quote, bad experience with the patient who said, hey, look on the clipboard, you tell me where I'm here, and other stuff. So at what point did you decide you were going to get into forensic pathology, and how did that exactly happen?
Yeah, that was toward the tail end of first year of medical school. And so I was like, man, I've already accrued so much debt. What am I doing? What is going on? And, we'd sit around with some of my classmates, some of my friends over beers and be like, dude, if I fail a test, I'm not going back. Like I passed, made it through. And I really didn't know what I was going to do going into second year. And luckily for me, it was they did pathology second year, how the diseases affect all the organs. And there was a very enthusiastic resident at the time who helped teach, Dr. Jeffrey Talman. He's still in Omaha, and I just gravitated toward him. He was happy. He liked what he was doing. He was very enthusiastic about teaching. I tended to find that I liked looking at stuff under the microscope. Like it was weird. Like we'd be learning organs and I'd be like, yeah, that's heart, that's liver, that's lungs. And I'd have classmates beside me be like, well, it's just purples and pinks. I don't know what I'm looking at. And I was like, well, I mean, if I'm good at this, then maybe pathology is the way to go. So kind of like when I went, I'm going to be a doctor, that was when, beginning of second year crystallized, I'm going to be in pathology. And so that was the goal for the rest of med school. And forensic pathology really didn't kick in as something I thought I was going to do. I honestly didn't even know it was a thing until residency, when Dr. Erin Lindy, who's still doing forensics in Omaha, she the same way. She an infectious personality, very positive, very enthusiastic about what she wanted to do. and I caught it, and I followed her around. Got to see some crazy stuff at the Douglas County. So it's a coroner system in Nebraska, so it's interesting. And I was like, I don't know, this is like a 1940s basement with one table and weird people here, and I don't know. Aaron loves it, but I don't know. So I did an away rotation at the Hennepin County Medical Examiner's Office in Minneapolis. And that's when I got to see what an ME system was like, what a medical examiner system was like, and it was incredible. It was a great experience. Dr. Andy Baker up there, I think he's still chief. I spent a month there, and I was like, yep, this is what I'm going to do. So it was definitely not what I thought I was going to get into when I thought I'm going to be a doctor. No, it was total like polar opposite of what I thought I was going to be doing.
So from your med school to Minneapolis, how do you end up in Tulsa?
So, I mean, I'm a Nebraskan, so I'm biased toward Nebraska. Them being a corner state and what I had seen when I was there, I was like, there's no way. I don't want to, as much as I love Nebraska, I can't work there. But we still wanted all of our families in Nebraska. We've got some family in Kansas. And so just wanted to be close. Started looking for job opportunities when I was in Kansas City, and Oklahoma popped up. The funny thing about that was I took it to our chief at the time, and I was like, hey, Oklahoma's got some jobs. And she goes, no, you don't want to go. You don't want to go to Oklahoma. It's that they're not name accredited anymore. I don't know. And she's very proud of the fact that the Jackson County office was name accredited. And then I brought up the fact that I knew Dr. Lanner worked in Tulsa, and she goes, Dr. Lanner, he helped me up here and he's great. Oh, you should apply. You should go. And so I did. So, and it was honestly the closest ME job to, what I guess I could consider home base of Nebraska. And it fit. The people are great. Everyone that works there is awesome. Investigate, from techs to investigators to administrative staff to the docs. It's been great. Never any doubts about it. Loved it from day one.
Yeah, I think the Tulsa office is comprised of a lot of really, really good people, and really Eastern Oklahoma by and large. So we're really lucky. So the system is, just for the listener, you guys responsible for all of the deaths in Eastern Oklahoma, essentially, or what is the kind of the line?
Yeah, I mean, the way I always explain it is there's like an imaginary line running north and south, sort of west of the Tulsa metro. And the Eastern Division, our office in Tulsa handles everything east of that line, from Kansas up north down to the Texas border. And then the Oklahoma City office handles everything to the west of it. It's area-wise, it's less area than the Oklahoma City office. I think we've got a few more population centers the Oklahoma City office does. We had an uptick in cases come around COVID time. So it's roughly split, or at least it was 50-50. Oklahoma City probably gets a few more cases than we do. But
wow.
And before I forget, as much as talking props about the ME people in Tulsa, as far as working with law enforcement, working with Tulsa Homicide has always been incredible. You guys are great at what you do, great at communication. And it's always been a pleasure working with you guys on cases.
Thank you.
Well, I appreciate that. Yeah, thank you.
Yeah.
What? How about the new building? You guys got a new building a couple years ago. How did that change things for you? Because I've seen both, and the new one is infinitely better, in my opinion, than the one you guys.
Oh, it's incredible. It's night and day. Part of the reason, and we get crap, I guess you could say, for not being a name accredited office. So just a little background on that. The National Association of Medical Examiners has like set standards that they want for offices to get that moniker of name accreditation. And I think it was around 2010 that it was lost for our office. And the reasons were not enough staffing. There is a point in time where Dr. Lanner was covering the entire eastern half of the state by himself for like 9 months. Like, that's insane. I wouldn't have stayed. like, it's a testament to him that he stayed. And the other is facilities. And I mean, you guys saw the old facility. I mean, there were times I was doing external exams in a hallway because we just didn't have enough space. We didn't have enough tables. I do miss the hallway a little because the techs and the ALAs put a little picture of me up on the hallway and said Miller Memorial Hallway. And then they gave me a Tom Selleck mustache. And so I got to see that every day. But I mean, the office wants to be name accredited again. And so that has been our push ever since. That's why I got hired, was to help with the amount of people that work there. And then the facilities are finally up to par. I mean, we've got 8 tables now. Before we only had 2. We actually have quality air control. When they were demolishing that old building on OSU campus, we got to see like the outside of the autopsy suite space just covered in black mold. I mean, it was horrific. And I know some of the investigators always complained about respiratory stuff, and it's like, well, there's why. So now, I mean, state of the art, we got CT, we got X-ray. We just started doing digital fingerprints. I know Sarah Campbell was working really hard on that. And we're to the point where it's time to try for name accreditation again. I think we're planning on, reapplying in 2025. So we're now well on our way now that we've got all that new stuff.
And so I guess
they were going to build a cafeteria there, weren't they? Wasn't that the original plan?
Yeah.
For
OSU. They were like, it's a food desert here. And we're like, yeah, we know. We don't want to go down to the corner store that has bars on it. And they were talking about it, and we thought it was going to happen. And then they just turned where our old office was into a green space. So I think they're still thinking about maybe putting a food court type thing there, but I don't know when it's going to happen. That's like Lanner telling me when I got hired in 15, it's like, we're going to have a new building soon. And I was like, okay. And then 16, 17, 18, 19, I was like, maybe someday it'll happen. But right now it's a beautiful green space to go and sit.
Yeah. So I have a question that it'll take both of you to answer if you guys don't mind. And Jason, if you'll take the cop part of it, and then Doctor, if you'll take it from there. Like for the listeners, when we get a murder, Jason, how does that process start for the cops, and then when it transfers over to the medical examiner's office, how does that go for you guys? But Jason, if you'll tell people that from like the initial call to patrol. And
well, the first thing that we try to do is we try to identify the person. We have a crime scene that we're gonna do all the measurements, videotape, photographs, measurements, and then we're gonna call the medical examiner's office. We don't actually get our hands in the pockets of the deceased. People don't realize that we can't touch the body. The body is under the jurisdiction of the medical examiner's office. And so we don't generally call the ME or the medical examiner investigator right away because we are not ready for the transport. There's a lot of things that will happen really, really quick if they show up. So sometimes we'll call them, and sometimes we'll say, hey, it's really, really important for us to try to get in this guy's wallet real quick, if you don't mind. And usually you guys are accommodating no matter what, you guys, as long as you know what we're doing, it's been great. And then we hand it off to them. Then the body or the deceased goes to the medical examiner's office, and then you guys do your thing. Amanda, try to walk over to my car and plug my phone in. So dual screen it with Ronnie and the good doctor.
Yeah, I mean, and you guys have always been really good about that. And it's a testament not only to you guys, but to our agency too. We got, so we'll get the call, say a homicide has occurred. We have ABMDI certified death scene investigators that go to the scene. Their job, unlike the PD, the law enforcement crime scene, I mean, they're solely focused on the body. And yeah, by the state law that you guys can't touch unless you get our approval. I've only gone to a couple scenes because, again, our death scene investigators are so good, I tend not to need to. One was there was a person duct taped in a closet, and they wanted to take all the tape for DNA. And so I went to the scene just to make sure I saw your crime scene was doing, make sure they weren't introducing any sort of trauma or anything to the body, and make sure everything was copacetic from that end. And the other one was someone who was unfortunately in a dumpster. And again, it was about what evidence you guys needed. And so you needed to get in there and start rooting around, and, wanted to be there to make sure that, no trauma. Again, the primary thing is to make sure no trauma is being introduced to the body that wasn't already there. But yeah, the investigators, there are kind of our eyes and ears. They get essentially, like, to put it this way, like I was mentioning earlier, if I was seeing a living patient, I need to get history. I need to know why you're here. I need to know what your past medical history is like. But unfortunately, my patients are deceased. So they're the ones getting all of that information from you guys, from witnesses at the scene, from EMS, from anyone they can. And when we kind of get crap for that from time to time, because they'll be like, well, you're biased and you're with law enforcement. But yes, they tend to be the primary information giver, but it doesn't mean like we're biased and in their pocket. I mean, it's just we need some information, and our patient can't give it to us. So they'll do all that. They'll sometimes do a rudimentary type scene investigation, like looking for casings or the where's the gun at, and how's the barrel look, how's the muzzle look, if there's meds or drugs around. But most of that gets left to your crime scene. After that, they send the body in. We do radiology. In the Tulsa office, the bag doesn't get popped. It gets sealed at the scene and doesn't get opened until one of the forensic pathologists is there to open the bag or be there when the bag is opened. And then we do our exam. Obviously, in like homicides, we'll do a complete autopsy where we, what I mean by that is we'll do the Y incision, we'll do a scalp incision so that we can access all the internal organs and look at all them. Document external trauma, internal trauma. We document essentially everything: clothes, scars, any injuries, tattoos, natural diseases. And that's kind of how it goes. We do toxicology on most of our cases. But the exam, I mean, it is the most complete physical exam you can have. And most of the time we've got a pretty good idea of what's going on by the time we're done with that. But
so in general, how long from, say, you guys investigators get called and they show up to the scene to the autopsy happens? What's the rough time frame that is?
By and large, it's usually something happens on day one. I'll get to see the body morning of day two. Yeah. There are rare instances where something happens earlier in the morning, and we'll get to see that body the same day. We'll open that body bag and do the exam the same day. But most of the time, it's scene happens, body gets transported to our office, body gets put in a cooler, and then we get to do the exam the following morning.
And I think something that maybe gets lost on the general public is they think an autopsy, at least some of the people I've talked to, think an autopsy, a full autopsy that you guys would do on a homicide victim, happens on every death, and that's just not the case. So what type of cases do you guys get other than homicides, and then how does that work on the level of the autopsy?
Yeah, so state law dictates what cases we accept jurisdiction on. I do think some people think we're just an autopsy service for everyone that dies in the state, and that's just not the case. So let's see some examples. If someone doesn't have a doctor, if they're unattended by a physician, so there's no one there to sign their death certificate, I mean, someone has to. So that falls into the medical examiner's purview. So those are typically those are cases where, medical history is known, maybe they're in their 60s or 70s. We do an exam, we find no evidence of lethal trauma. We take specimens to check for any sort of toxicology, but by and large, most of those cases can just get an external exam and that be it. There's some times where there's some trauma involved, like maybe you have an elderly individual that fell and hit their head, and we want to check to see if there's any sort of significant intracranial trauma. from that fall, where we'll do what we call a limited autopsy, where we'll just look at like a single organ or an organ system. And so like in that type of case, we just open the head and look at the brain and inside the cranial vault, and that be it. There are things that dictate who gets full autopsies, you know, suspicious traumatic cases, pediatric cases by and large, cases where, sorry, I just had a brain fart, where people are young and have no medical history, and so an external exam just wouldn't be enough. Overdoses should get full posts. I know that we're working toward that. If we right now, I mean, now we're in a much better place. When I started in 2015, if we tried to do full autopsies on every overdose, we would be so far behind. And you see that in offices across the country. So honestly, because we weren't name accredited, it just went to the forensic pathologist, and we used our best. You know, we did what we needed to do to get the, you know, the cause and manner of death. But yeah, it varies from case to case. Everyone's unique in life as they are in death. So not everyone gets a full post.
So another thing we've kind of talked about, from text to the investigators, the doctors, the admin staff. How many investigators do you guys have, and then how many pathologists do you guys have there here in Tulsa?
Well, I know right now, so we have new pathologists starting up in the Tulsa office. One just started, and one will be starting in August. I think that brings us to 1, 2, 3, 4, 5, 8. And when I started, we were at 4. Wow. And I think the Oklahoma City office they have a couple new people coming from California, and they'll be at, I think, 11. As far as how many techs or investigators, or I don't know. I mean, if the state would give us more, I mean, we could definitely use more. It's sort of one of those deals where technically we're fully staffed, but the minute someone like an investigator or a tech needs to take a vacation or do something with their kids or whatever, then we're short, because there's no one waiting in the wings to fill in those spots. So, I mean, we've got, at least for my day-to-day, we have at least 1 tech per doctor when we're working downstairs. And that's honestly all we need. More techs is better. It helps things go faster. But I mean, right now we're in a really good place. And I hope it stays that way. So
it looks like Jason's frozen, so I'll just keep asking some stuff till he comes back to the living. But so in this part, I guess feel free to answer it however you feel comfortable. And for the listeners, hopefully this doesn't upset anyone, but how do you deal with a baby versus a kid versus an adult versus an older person? Is there anything that affects you just as a human differently, or is it, hey, this is my job and I got to get the answers? Because just relating that to homicide, I know I had to work cases where little kids got killed up to elderly, and people would, the one that jumps out to me, there was a kid that got killed by his father. My daughter was roughly that kid's age at the same time, and a guy came up to me and he's like, hey man, do you want me to take this case for you? That kid's roughly your daughter's age. And I'm like, no man, I'm good. I appreciate it. And I mean, I had to do my job, so I did what I had to do. So how does that relate for you?
I mean, that's kind of the same. It's part of my job, so I have to do it. The kids, honestly, anyone that's younger than me always hits me a little harder. So I'm like, man, especially, I mean, even now when I see people that are my age, I'm like, I mean, this could be me. Like, this is crazy. Like, how are you not still alive? Especially after doing an exam and you see that there's, should be nothing wrong with them from a natural disease standpoint, and they've got trauma or drugs or something else. So yeah, it's really sad, especially the kids. But at least for me, it just honestly, especially with the kids, it just drives me to work even harder. Like, I really want to know why. I mean, sometimes, with trauma, it's easier to get to that point, but then it switches to, well, then I want to make sure I'm as detailed as humanly possible, so that no one down the line, let's say something gets adjudicated, can say, well, that potential suspect got off because Dr. Miller didn't do a good job, even though that's not part of my job. You know, my job is just cause and manner of death. My job's not to convict anyone or say this person did whatever. I still don't want my work to affect a case negatively by lack of attention to detail or not doing, you know, exam stuff I should. But as far as, you know, how I deal with it, I guess it's a couple things. It's kind of like, you know, not actually seeing the death occur. Like I have a dead body, and you've seen enough dead bodies that, and you've seen dead bodies too.
Yeah.
Whoever that person was, that they're gone. That it's not that person anymore, and you can see it. Like it's like I don't even know how to describe it. It's like they're not just sleeping. You just inherently know it. Like they're not there. Whoever that person was is gone. And I guess my Christian faith helps with that a little, because I know, you know, their soul, they're in a better place. You know, I've got, I guess it's cliche to say, like a shell of that person. And so it helps detach from it. Like I'm looking for findings. I'm looking for eye color. I'm looking for blunt force trauma. I'm looking for. And so as long as I focus on that and not, you know, the age or who that person was or what their aspirations were at some time or what they wanted to be when they grew up, that it helps make it a lot easier. You know, having good family support helps. Video games help out a lot. I wish I still ran. I use running as a way to de-stress, and I get home from work and I'm like, no, I'm not gonna go. I'm not gonna go out and run at this point, and I'm not gonna wake up early because I'm up until 2 or 3 a.m. playing games. So no, it's video games and family, and you know, good work relationships. The people you work with, very supportive.
Yeah.
People always know. I wear my emotions on a sleeve, so if I'm having a bad day, people know it. And having good coworkers to come by and make sure you're doing all right and talk with you about it always helps. The agency in general is really good about making sure that that we're doing well from a mental standpoint, because it can get stressful.
That's something that I think really improved during my time on the police department. Jason and I were both on what we call CERT, Critical Incidents Response Team, because, and we've talked about it a little bit on here, people who were involved in shootings or a crazy car chase that turned into a wreck where somebody died. And so this group got formed to, and the people who were in those situations and handled it well, then they would go out and talk to other officers when one of those would happen. And the stigma of, hey, it's okay to talk about mental health just really improved on the police department during my time there. And it sounds like you guys have a similar support system there. So that's good to hear.
Yeah, you guys had interviewed Lexi before. You know, we're really getting that wellness unit, I guess you could say, up with our agency. Really been, as an agency, focusing a lot more on wellness, especially the last couple of years, making sure that there are avenues for people. We do yoga once a month. And I saw that you are now like a yoga master, some sort of yoga guru.
Yeah, I just finished I finished my yoga teacher training, and if all things go as planned, then I should be teaching a 5:30 a.m. class there at Lifetime on Wednesdays.
5:30 a.m. Oh, Ronnie, it's early, man.
Yeah, but no, I enjoy that, and so hopefully that comes. It sounds like it's all but a done deal at this point, but
That's
yeah,
awesome.
Thank you. Yeah, come to the class.
Yeah, I used to be a Lifetime member, and then there was some drama with the swim team at Lifetime, and my daughter does swim, so yeah, I'm no longer.
Okay. Well, we'll let you go.
Hey, does he got to go?
No, I was no. Go ahead. You got something?
No, I'm back, and the position I've got. If you notice that, there's nothing like this. You talking about death in the background while I'm sitting in front of a restaurant, but
hey, you should hear some of my over dinner table conversations. It's something else.
This view behind. So one of the things that I had to do while I was sitting there, I had nerves of steel while you guys were talking, but I had two daddy long legs actually crawl on me, and people realize those are the most deadliest spiders in the world. They just can't bite through your skin. So, but you didn't notice, but I didn't freak out. I just flicked them off and went about my way.
Good
But
for
no,
you.
Lexi, you'd mentioned Lexi real quick.
Yeah.
I'm so impressed with her. She's just really, really an amazing young lady. And I was
We're lucky
really,
to have her at the agency. I mean, I don't get to work with her much because she's in Oklahoma City, but I increased contact since she started doing the wellness stuff.
Another thing I just wanted to clarify.
but anyway, if I happen to break here and lose you guys.
Yeah, we can't hear you, Jason.
Thank you, Steph. I just sometimes stuff pops up in the big screen, and
yeah,
thank you, Steph.
I guess one last thing on as far as the process there at the medical examiner's office, and I would think a lot of people who are listening maybe have this question. So once you get done with that, what happens to the body at that point? How does it end up at a funeral or in a grave or anything like that? What do you guys have to sign something off, and then how does that kind of go?
Yeah, after essentially the FPs give permission for release. I mean, once we're done with our autopsy, honestly, people can get back to their families pretty quickly, depending on how long, sometimes when it gets busy, we won't do it the next day. It may be the day after. But after the exam is done, unless there's some identification issues, or like with suspicious cases, we'll have law enforcement come and do fingerprints, because our fingerprints are only for identification purposes. We don't share that with law enforcement for like their investigation. So there may be some delay as law enforcement comes and does whatever evidence gathering they want to do, primarily the fingerprints. And then we'll confirm ID scientifically on all those cases. So that's a little bit of a delay, but not a lot. I mean, the big delay for us is getting to the final report, which could be weeks, could be months down the line, depending on when ancillary studies come in, like toxicology and things like that. But after we're done, I mean, we let the funeral homes know, and they come and pick up, and they do their aspect of it.
The one thing I was going to say, that when I was working homicide, it seems like the biggest holdup on getting the final report from you guys, it always seemed like it was the toxicology.
Yeah.
And that's just because, if I understood correctly, everything had to go to the lab in Oklahoma City or something, and they were dealing with the entire state.
We're instead of, like, a lot of agencies send their stuff to a reference laboratory that has the staffing, has the equipment to handle high caseload. And I'm not saying we don't, but we have a high caseload, and it all gets filtered to the toxicology office in Oklahoma City. They've added new equipment, new chemists. We now have 3 toxicologists. I think they're looking to get a 4th. And so the time frame has gotten better. And part of name accreditation to get reaccredited is to make sure our cases aren't lapsing more than either 60 or 90 days. And so they're working well toward those goals, and it's getting much better. But yes, it does tend to be toxicology that holds things up. Like, I'll get a toxicology report, and I can have the report done usually that day. Usually everything is ready to go at that point. It's just a matter of revising, crafting, and putting it in the records pipeline.
Okay. So as Jason usually says, the time has flown. We're at our 54 minutes, and I know we got a little bit.
Like we could have talked for hours.
I know
we could.
Yeah. So for those that have missed Jason's normal talkative self, sorry that he's had the connection issues. I think we got through this fine though, and he'll be back and better next week. And you talked about Dr. Miller. I'll give you the final word here. We had that picture of you talking to the kids. Is there anything that you would say to people who are interested, not necessarily even forensic pathology, but just getting in, becoming a doctor at all? What would you tell anybody?
Yeah, it's stereotypic to say, I guess, but just do well in school, listen to your teachers, listen to your parents. You keep doing well in school. That's all you need. You do well in school, you're going to get where you want to go. You put in the effort, you're going to get there. no, it's great talking to kids. We're short in forensic pathology. We need forensic pathologists. So the more that I can get into schools and let people know
Hey,
what I do.
thanks for being here. Amanda's about freaking out, I'm sure, no doubt. We've definitely hit
We'll have to do it again.
Ronnie, take us out. Hey, Dr. Miller, thanks for being here. We
Yes,
really
Thanks for
appreciate
having
your
me.
time.
This was great.
Ronnie, take us out all the way.
All right, everybody. Thanks for joining us, and we'll be here next week with a super guest that Jason's excited to show off, and I'll leave it at that so you guys show up. But thanks, everybody. We'll see you guys next week.
See you guys.
Thanks, guys. Thanks for having me.